Hi there, this is Rowan Alice from Body Synergy, and this is Abby, and we're going to take you through our latest version of our Rehab warm-up driven by science from Mr. EMG. We're going to start with standing glute meads. Hold the bike, stand nice and tall, tuck your bottom under, 15 reps each side, starting on your left leg. Do not rush this exercise. I want a definitive squeeze of your glute med, the top of your hip, every single rep. This is about improving activation of the muscle. How many reps, Abby?
9.
Great, that's 9, 10, 5 more, don't rush. Notice how Abby is bracing her upper body perfectly still, so she's really isolating her left side. How many abs? 15, right, reset, shoulders down, bottom tucked under. And now right leg for 15 reps. Like I said, do not rush. I want a definite squeeze of your glute med every single rep. And also have the awareness to feel your upper neck is relaxed and you're bracing with your left leg as you lift your right leg. Good work. How many reps, Abby?
10.
5 more, not rushing, take your time. A good squeeze of your right glute med. Great work, Abby. Great work at home. All right, our next exercise is glute max kickback. Standing there, tuck your bottom under, kick your leg back, and aim for a squeeze of your big glute max muscle. You'll see Abby's glute max engaging there. She's got very muscular glutes, so let that be motivating for at home. You'll find your abs are bracing you to stop your pelvis rolling forward. Look how Abby's bracing with her shoulders down, anchoring on the bike. How many reps, Abby?
11.
A little bit slower. 12, that's great. 13, 14, perfect tempo. Last one. All right, stand up, reset, breathe, shoulders down, bottom tucked under, right leg. Good stuff. From this angle, we can see Abby's glute max contracting well. She's squeezing it at the end of the range. She's bracing with her left leg. So be aware of tension you're feeling in your body. Your neck wants to be relaxed. You want to be bracing your torso with your lats. Keep breathing. Don't hold your breath. And match Abby's tempo. How many reps, Abs?
12.
3 more. 14, 15. All right, we're going to transfer to the floor on our hands and knees for fire hydrants. All right, so we're now set up on the floor on your hands and knees for fire hydrants. On your left leg, tuck your bottom under, Abby, and away we go. Lifting your leg up, squeezing your glute. Again, do not rush. The purpose of these exercises is to improve activation of the muscle. We're trying to stimulate the muscles we're trying to target without stressing your spine. Keeping your upper shoulders relaxed and aiming for a definitive squeeze of your whole gluteal complex and the muscles around your hip. How many reps, Abs?
11.
Is that 13? 14? 15. Right, take a breath, reset, take your bottom under again to unload your lower back, and away we go. Now on the right leg. Now if you're exercising and doing this rehab video, if you feel any pain of a 3 out of 10 or below, that is safe to keep going. Any pain above a 3 out of 10, you want to stop and seek medical advice. But take your time with this routine. Each time you do it and practice it, you will get better at doing it. How many reps, Abs?
13.
14, 15, well done. Now you're going to lie on your tummy. We're going to do prone cobras. All right, this is for your upper back. You're going to lift your upper body up and turn your thumbs towards the ceiling while keeping your legs down. Really trying to isolate that mid and upper back. Abby's got a fantastic range of movement through this exercise. You may not be as good as this when you start, but this is your goal. You should feel no discomfort in your lower back. Keep your glutes locked on to anchor your hips and lower back, and don't lift your feet in the air. If you do, you'll increase the stress on your lower back. How many reps, Abby?
That'll be 9.
That's fantastic. Take your time, match Abby's tempo at home. Notice Abby's keeping her head in a nice neutral position. She's not lifting her head back. This is exactly how I want you to do this exercise, with your thumbs going to the ceiling. How many abs?
14.
2 to go. Breathe. Match Abby's tempo at home. Fabulous. All right, now onto your hands and knees for pelvic rocking. Shoulders down. All right, let your bottom sag down and then tuck your bottom under. So when you tuck your bottom under, really think about your deep abdominals contracting when you tuck under. Now, again, Abby's got a sensational range of movement through this exercise. You certainly won't have if your back's sore when you start, but this is your goal. Again, feeling some discomfort with this exercise, a 3 out of 10 or below is fine. Don't push it. Start with very subtle, small movements, and as you gain in confidence and are comfortable with the range, you will gradually make improvements. But when you tuck under, so Abby's going to tuck under now, and that's when you want to feel your deep abdominals really contracting. How many reps, Abs?
12.
Great. Nice range, Abby. All right, now we're going to do a serratus hold. Abby's going to start doing in the press-up position from her knees, so you get an idea of where you're starting with your back rounded up. We're going to do 30 seconds like this, and then for the last 30, Abby will go to her toes for a full press-up position to hold it. Now, your goal with this exercise is to isometrically contract what's called the serratus anterior muscle, which helps stabilize your shoulder blades. Through Mr. EMG, we've been able to test this exercise and find this is a safe, effective way to make this muscle engage and activate very well, improve the neurological stimulation to the muscle. And it's easy to do just by getting in a press-up position and rounding your back. Okay, Abby, onto your toes now for the last 30 seconds. Good, so Abby's back is nice and flat. This is going to engage her quads and her shins and her whole core, abdominal muscles. And you've got to round your back up high like Abby is to make that serratus anterior work hard. As you advance through from your knees, and you can do a minute, then you can get into this full press-up position and hold it for a minute, which would be outstanding. All right, Abby, 5, 4, 3, 2, 1. All right, we're now going to transition to reverse Nordics. All right, now we've transitioned to reverse Nordics to stretch your quads out and hip flexors. Grip the band up nice and high in front of you, shoulders down, glutes on, and drop back and pause for a second to stretch your quads, and then let the band pull you up. It's very important when doing this movement to pause at the bottom for a couple of seconds. Okay, this eccentrically stresses your quads, and over a period of a couple of 2 to 3 months, it will cause a process called sarcomeroneogenesis. It will make your quadriceps grow longer. If you come to see me for a consultation and you have what's called a positive Eli's test, which we do, we lie you on your tummy and flex your knee, and your short quads are loading your back or having an impact on your back, this is why we get you doing this exercise, to safely create stimulation to get your quads to grow in length, increasing the range of movement so that less stress is on your back from them. How many reps, Abby? So Abby's range now is where your goal is to get to. Do not force this exercise. It takes time to improve with the mobility. Abby's been doing this for a long time, so she has an amazing range of movement. Don't try and get there overnight. It can take 8 to 13 weeks to get this range. And the tempo Abby's doing it is absolutely perfect. You do not rush. How many abs?
12.
3 more, nice and slow. This routine is fantastic for improving your overall muscular awareness, calming down hyperactive muscles, improving the feel of your mind-muscle connection. and making you feel more confident and robust within your body. How many abs? All right, so stay in the kneeling position there. We're going to work on our deep abdominals, our transverse abdominis. So suck your tummy in, Abby, as hard as you can. Hold it for 3, 2, 1, relax. And again, suck that tummy in, make your waist small. You've got to be quite aggressive with this exercise. Relax. And again, suck that tummy in, Abby. Draw your pelvis up, your pelvic floor up, and relax. Number 4, suck that tummy in, make your waist as small as you can. 3, 2, 1, relax. Breathe, suck that tummy in. Hollow your tummy, draw that belly button towards your lower back. Relax. And again, suck that tummy in. Make your waist small. 3, 2, 1, relax. Keep breathing. Draw that belly button in. This is rep number 7. 3, 2, 1, relax. And again, neck relax. Suck that tummy in. Keep trying to keep breathing. Make your waist small. 2, 1, relax. And again, suck that tummy in. Make those deep abdominals fire. Relax. And again, suck that tummy in. Make your waist small. 3, 2, 1, relax. Right, 5 reps to go. Breathe. Right, aggressively suck your tummy in. 2, 1, relax. Good work, Abby. And again, suck that belly button in. Be aggressive. 2, 1, relax. 3 to go. Suck that tummy in. Make your waist small. 3, 2, 1, relax. 2 to go. Suck the tummy in. Good work, Abby. Good work at home. 2, 1, relax. And last one, suck that tummy in. Make your waist as small as you can. 5, 4, 3, 2, 1. All right, we're going to transfer to a seated position for our last couple of exercises. All right, moving to seated thoracic rotations. You cross your arms on your chest, shoulders down, and you're going to turn 5 times to the left as far as you can. And back. Good range, Abby. This is a fantastic exercise for your lower traps and your serratus anterior muscles and your chest to help increase your thoracic rotation, which again takes stress off your neck and lower back. We're going to do 5 times to the left. 1 more. That's all. Abby's done 5. She's now moved to the right. Good range, Abby. Don't rush this exercise. It's very important to use your own strength to increase your mobility. How many abs?
4.
Last one. To the right. Now we go to the left again. Shoulders down, turn. Really try and use muscle effort to turn yourself around. Increase mobility through your rib cage. This will help increase mobility through your back and your sternum for your ribs, which is very important. How many?
4.
Great. And now we go to the right. Good range, Abby. This is your goal at home. Improving your rotation to match Abby's. Good. Hold it a wee bit longer, Abby. Good. Last one. All right, arms down, relax. Now we're going to do work on your neck rotation. Good for your sternocleidomastoid. Turn your head to the left as far as you can and back. We're going to do 5 times each side. You've really got to try quite aggressively again with this in a controlled manner. Turn your head as far as you can. This helps your sternocleidomastoid muscles in the front of your neck, and your neck stabilizes in the back of your neck. We've measured this on Mr. EMG. It's a fantastic exercise for targeting those muscles without stressing your spine. Make sure you perform the exercises in a nice controlled manner like Abby is. After you've done this exercise for a couple of weeks, when you're driving in traffic or turning to reverse your car, you'll notice an incredible difference in mobility. All right, last time, 5 reps to the left. We're just about through this rehab workout. Thank you, Abby. Thank you at home. Great range, Abby. Turning as far as you can in a controlled manner with your shoulders down. Good stuff. All right, last 5 reps to the right. And if you're doing this at home, I recommend you do this routine 5 out of 7 days a week to improve your muscle awareness, muscle engagement, range of movement, and confidence in your body. How many, Abby? 5. Thank you. Thank you, Abby. Thank you at home. Enjoy your day. Keep those shoulders down.